In this lecture, we're going to be covering chapters 13 and 14 in our Medical Law and Ethics textbook. Chapter 13, Death and Dying. The dying process. Death is inevitable. Modern medicine has enabled people to live longer and survive diseases. Patients can now be kept alive by medical technology. Healthcare professionals have a duty to preserve life. The legal definition of death. Determination of death is important for many reasons. A person who has expired is no longer treated the same way as a living human. The actual determination of death is critical due to organ transplants and life support systems. Technology allows sustaining an otherwise, quote-unquote, dead person. The Karen Ann Quinlan case occurred April 15, 1975, in which a 21-year-old unconscious person from a prescription drug and alcohol overdose. A tracheotomy and respirator were inserted to help with breathing and nasogastric tube for nourishment. The patient was comatose or permanently in a vegetative condition. The father appealed to have the respirator discontinued. The respirator was discontinued, but the feeding tube continued. The patient lived in a coma for 10 years without a respirator and then died. Criteria for death. Assist in determination that death has occurred. Loss of a heartbeat, significant drop in body temperature, loss of body color, rigor mortis. Symptoms may not appear until several hours after death, or not at all if life support equipment is used. Cardiac death, death in which the heart has stopped functioning, lack of pulse or breathing, is considered a legal death. Irreversible loss of all cardiac function. Serious problem occur for organ transplants. Brain-oriented death. Death occurs when there is irreversible cessation of all brain function, resulting in a persistent vegetative state. Most states accept this definition of death. Heart and lung functions can be maintained by mechanical means after brain function is stopped. The Harvard criteria for definition of irreversible coma: unreceptive and unresponsive with total unawareness of externally applied and painful stimuli. No spontaneous movements or breathing, absence of a response to pain, touch, sound, or light. No reflexes with fixed, dilated pupils, lack of eye movement, and lack of deep tendon reflexes. Brain-oriented death, brain death. Some ethicists believe that if there is some level of consciousness, then the patient is not dead. Recent studies indicate that some vegetative patients may actually have brain activity. The Uniform Determination of Death Act was approved in 1990. Individual is dead if he or she has sustained either irreversible cessation of circulatory and respiratory functions or irreversible cessation of all functions of the entire brain, including the brain stem. Withdrawing versus withholding treatment. Withdrawing means to discontinue treatment after it has been started. Withholding means never starting the treatment to begin with. Many people believe both are ethically wrong. Patients have the legal right to refuse treatment and food. Active euthanasia versus passive euthanasia. Active euthanasia is the intentional killing of a terminally ill, is illegal in all jurisdictions in the United States except Oregon and Washington. Physician-assisted suicide is where the physician provides a patient with medical know-how or the means to enable the patient to end his or her own life. Passive euthanasia is allowing a patient to die naturally, and this is legal. There is a slippery slope argument concerning assisted suicide, that it might lead to a diminished respect for life. It might slip into allowing a non-terminal patient to die. The Nancy Cruzan case, January 11, 1983, a 25-year-old injured in an auto accident was left in a vegetative state. A feeding tube was implanted. The family requested that the feeding tube be removed. The United States Supreme Court ruled against the Cruzans. New evidence of Nancy Cruzan not wishing to be maintained, as in the Karen Quinlan case, arose. The feeding tube was removed, and Nancy Cruzan was pronounced dead on December 26, 1990. The Terry Schiavo case was a woman in a persistent vegetative state. Her husband sought to have her feeding tube removed. The tube was removed by court order. The governor ordered the tube to be reinserted. Terry Schiavo finally died after the tube was in fact removed. Direct versus indirect killing. A direct killing is where death is a result of another person's intended action or inaction, and indirect killing is death is a result of unintentional action of another person. The double effect doctrine: an action may have two consequences, one desired, so the intended consequence, and one undesired, or the unintended consequence. Ordinary versus extraordinary means. Ordinary means is treatment or procedure that is morally required, such as supplying fluids and comfort measures, may be called appropriate. Extraordinary measures, procedures, and treatment that are morally expendable, such as chemotherapy, tube feeding, CPR, and mechanical breathing or respirators, may be called inappropriate. Right to die legislation or right to refuse treatment. Patients have the right to refuse treatment. If refusal places the patient's life in danger, legal action sometimes results. Stages of dying. According to Dr. Elizabeth Kubler-Ross, dying process is divided into 5 stages. Patient, family members, and caregivers all experience. The stages may overlap and may not be experienced by everyone in stated order, but all are present in the dying patient. Denial, anger, bargaining, depression, acceptance are the stages of dying. Quality of life issues. Measures to assess quality of life include general health, physical functioning, role limitations, bodily pain, social function, vitality, and mental health. Use of medications. Patients who are terminally ill often spend most of their last days in moderate or severe pain. Physicians are often reluctant to overprescribe pain medications for fear the patient may become addicted to the drug. Many physicians now believe patients' pain and suffering should be controlled with the use of adequate medications. Hospice care is designed to provide care and support services to terminally ill patients and their families. This originated in France. It is committed to keeping patients with terminal illness as pain-free as possible. Hospice care is focused on providing comfort measures, emotional support, and as pain-free as possible final environment for the patient. The staff is especially trained in caring for dying patients. Palliative care is total care of patients whose disease is no longer responsive to curative care. It consists of comfort measures. It's meant to provide a relief of pain and suffering so the patient can die with dignity. Emphasizes symptom control. It is the opposite of curative care. Biatical settlements allow people with terminal illness to obtain money from life insurance policies by selling them. In exchange for 20 to 50% discount on the face value of the patient's insurance policy, a patient can have immediate access to the money. A patient names settlement company as the recipient of the death benefit. Many use the money to provide for medical and nursing care during the final phases of their illness. Advanced directives, documents such as a living will, durable power of attorney for health care, the Uniform Anatomical Gift Act, and do not resuscitate DNR orders, popularly known as living wills, limit type and amount of medical care and treatment patients will receive if they become incompetent and have a poor prognosis. Suicide is considered morally wrong and illegal in most states. No state punishes people who attempt suicide, but they may be placed in psychiatric care if present danger to themselves or others. Many religions condemn suicide and euthanasia. Choices in life and death, antidepressants and suicide. Depression medicine may actually cause an increase in depression. Men are at a higher risk of suicide than women. Age is also a factor. Risk for non-fatal suicidal attempts. 11 estimated suicide attempts for every suicide death. Prevention should be performed by trained professionals. Medications and psychotherapy are major treatments. Survivor's guilt is where one feels that they could have prevented a death. There's a stigma or disgrace that's felt. Family and friends may need counseling. The case of the conjoined twins, death resulted during a procedure in July of 2003, a 50-hour operation to separate 29-year-old twins joined at the hip. The twins knew of the risk, but knowingly accepted them. Many ethical debates about the separation have been made. Mechanical heart recipient. An artificial heart was implanted in a 59-year-old man in July of 2001. It did well until he suffered severe strokes from blood clots. In the final days of life, he was partly paralyzed and breathing through a ventilator. He lived for 5 months with the mechanical heart. Chapter 14, Future Trends in Medical Care and Healthcare. Healthcare is changing. New treatments, medications, and procedures are constantly being created. New laws, such as the Patient Protection and Affordable Care Act, have been implemented, and with every new development in the medical field, new ethical dilemmas arise. Problems in the current healthcare system. First, do no harm. Preventable medical errors are killing 100,000 Americans every year. Incorrect diagnosis, drug mix-ups, needle infections, and surgical mishaps. More hospitals are creating educational programs to attempt to resolve these problems. The cost of healthcare. Cost wasn't always a deciding factor. Expensive procedures such as MRIs, prescriptions, defensive medicine, excessive medical screenings, yearly mammograms, all added to the cost of our healthcare system. Medical bills and illnesses are currently responsible for about 1/2 of all bankruptcies in the United States. Lack of healthcare providers. Low-income patients use hospitals as a primary care provider. Many are sicker than high-income patients. They are generally admitted to the hospital through the ER. Physicians who provide care to the indigent are on the decline. Germ warfare. Nearly 2 million patients a year develop hospital-based infections. Many of the deadliest bacteria are now drug resistant. Medical fraud, which is the intentional deception or injury to another person. Fraudulent credentials, medical records, billing, and drug trials. Other problems in the current healthcare system include prescription drug abuse. Accidental fatal drug overdoses have risen 500% since 1990. It is now at epidemic levels. Oxycontin, Vicodin, methadone are all drugs that are abused. Ethnic disparities in healthcare. African Americans, Latinos, and American Indians do not always receive good health care. They often lack insurance. Language barriers complicate the process, and there is sometimes subconscious bias towards ethnic groups. New advances and improvements in healthcare. Promoting prevention and health screenings. Too much emphasis on treatment rather than wellness. Patient rights, awareness, hospital charts, the right to be seen by a medical doctor and not just a resident. Other advances and improvements in healthcare, the use of robotics, machines to perform human tasks such as supply delivery, medications, and meals, surgery, surgeon-controlled robotic arm. This has many applications and allows surgery with smaller incisions. The ethics of using robots and robotics. Robotics enhances a surgeon's skills. It does not replace them. Some healthcare employees are fearful of losing their jobs to machines. Healthcare trends and reform. The history of healthcare laws and programs. The Federal Emergency Treatment and Labor Act of 1986. The Children's Health Initiative Program, CHP, was passed in 1997. Accountable Care Organizations, ACOs, group of providers accountable for the care of a group of patients. MCOs, HMOs, PPOs, Medicare and Medicaid, and COBRA are all different variations of ACOs. Healthcare Trends and Reform, Health Maintenance, the Patient Protection and Affordable Care Act in 2010, the Affordable Care Act. There are many supporters and opponents to the ACA. We're still trying to determine the revenue and cost, benefits and liabilities. The idea is to extend coverage to everybody, but that's proving difficult, and there's a higher emphasis on preventative care. The Patient Protection and Affordable Care Act in 2010 created insurance exchanges, the American Health Benefit Exchanges, health exchanges. They're state-based, and they allow consumers to review and compare online plans in each state. The Patient Protection and Affordable Care Act also eliminates exclusion from obtaining insurance if you have a pre-existing condition. You cannot be denied coverage any longer for pre-existing conditions. Early implementation problems included initially there was no deadline for enrollment. Enrollment doubled expectations in some states, causing the websites to crash. And then a lot of people opposed to being fined if they failed to pay for the insurance. This was the mandate, or part of the mandate of the Affordable Care Act. Adverse selection. Insurers must cover children despite the presence of pre-existing conditions. Birth control and abortion. Insurers must offer preventative care. Some organizations are exempt. Some states may prohibit abortion coverage. The ethics of care under the Affordable Care Act. Healthcare law scams, fraudulent claims to acquire personal information. Subsequent Medicare claims have been paid. Health literacy, from the standpoint of how do we teach our patients.